We're going to talk today about pathology of the female genital tract and in particular carcinogenesis. It's good to be able to diagnose malignancies, but it's even better to be able to diagnose it at the pre-malignant stage where you can save patients' lives. We're going to talk about cervical, endometrial, and ovarian carcinogenesis, and we just cover quickly the endometrial cycle. We're starting with the cervical carcinogenesis, and it's going to be in 3 parts: general, HPV infection, and HPV vaccine. The general part contains the specimens. We receive cervical biopsies in the form of punch biopsy or cervical loop and cone. Both of them include the entire os. They remove the abnormal area, and especially they try to include the squamocolumnar junction. This can be demonstrated in this slide where we see the endocervical epithelium joining the squamous epithelium. This is the most important part of the cervix in the context of cervical carcinogenesis, where CIN starts. Looking at this cervical loop or cervical specimen, there is some erosions, but the appearances are equivocal, and it might be normal, might be showing some malignant or pre-malignant changes, in contrast to this loop where it shows pronounced changes consistent with carcinoma. For the second part, HPV infection, please refer to the movie attached in a separate file. Grading of cervical intraepithelial neoplasia CIN depends on the extent of lack of maturation of the squamous epithelium. If it involves only the lower third is CIN1, if it involves the lower 2/3 is CIN2, and when it is further than that is CIN3. Most HPV changes are transient and they are subclinical. Once the virus gets incorporated into the DNA, it's likely that it changes to CIN2 and CIN3, and perhaps on occasions it changes to invasive malignancy. This is an example of full thickness lack of maturation where atypical cells are seen at the surface. There is an atypical mitotic figure by the arrow there in the middle. This is a pre-malignant condition. CIN3 could lead to invasive squamous cell carcinoma, as in this example. However, this is an early stage of squamous cell carcinoma where treatment and cure is likely. Most cases are diagnosed these days at an early stage due to the successful cervical screening program.